I figured I'd just start off by giving a little bit more detailed background about where I come from, sort of what I'm doing here. And then talk a little bit about what my group at HHS does from a high level, and then sort of throw it out there just for questions and conversation. So you heard the bio. Most of that is true. I really am sort of software entrepreneur, computer science guy by training and at heart. And started a software company in California in '97, grew that for a while, and then moved over to London to open up the European and Asian offices for the company when I got a random phone call from the city of Washington, D.C. asking me if I'd be interested in talking to them about being this combined CIO-CTO role. Very much out of the blue. Still don't really know to this day how they found me. I got a phone call. I was on a train back from a meeting in the north of England back to London, and I got this random phone call from, I pick up the phone and the guy goes, "Hi, Brian, this is Wayne from Washington, D.C. Hi, Wayne. And so one thing led to another, and I ended up actually accepting the job and joining the DC government, which was actually quite an amazing experience. City government's fun. It's it's like a little two-seater sports car, right? It's super tangible. The things that you do have immediate impact. I mean, you can literally make a decision and then the next day see the impact of that decision. The interesting thing about the DC government that I joined was that, I don't know if you guys are familiar with Mayor Fenty, but I think one of his true geniuses was that he hired people to run his agencies who were just very, very good at what they did and let them do it, right? There wasn't a lot of oversight. There wasn't a lot of making sure people did the right thing, which in an interesting way led to all of his cabinet members being very non-competitive, right? Nobody was jockeying for time with the mayor. Everybody was actually very willing and able to help each other because nobody felt threatened about whether they were getting the right kind of airtime or what have you. So it was actually a really interesting environment. As you guys from around this area probably know, Mayor Fenty was unelected at the end of 2010, I believe, at the end of 2010. And then as new mayors or elected officials are wont to do, Mayor Gray came in and basically cleaned out the cabinet. But that's when I met Governor O'Malley, who personally I think is a pretty wonderful and amazing guy. He's one of the few elected officials that I've met who really knows how to run a large organization. And when I look at what he's done in Maryland, I think there's a lot of, agree or disagree with his policies. His style is something that I think is very replicable in that he uses data to make decisions, right? When he first started at the state, he basically laid out 15 strategic goals that the state was going to try to achieve, and each one of those strategic goals was measurable and time-bound and had a series of initiatives underneath it that all contribute to that overall metric, and then he followed through on it, right? So every couple of weeks he sits down with a different group of people that are responsible for one of those goals and says, how are we doing? And it's amazing when you actually, it's not amazing, it's logic, right? But not enough of our elected officials, I think, have the right set of experiences to kind of bring that to bear. And so it was great to kind of be a part of that and to watch that happen. So I had this plan. I went to Maryland. I decided that this was going to be my last job in the private sector for a while. Actually, I had two rules. It was going to be my last job in the private sector for a while, and that I would never, ever, ever, under any circumstances, work for the federal government because it was far too bureaucratic and crazy, and I just can't deal with bureaucracy. And then I had coffee with Todd Park. And for those of you who know Todd can be very enthusiastic and energetic. And actually, it was funny. I'd met Todd a few years ago, and so when he moved over to the White House, I said, hey, this is great. I got all this stuff I want to do in Maryland. Todd's at the White House. It's not just about health, but it's about all this stuff. We're going to, let's get together, have coffee, figure it out. So we went and had coffee, and I got about halfway through my spiel, and he was like, listen, dude, hang on. Because, those of you who know Todd, he says dude a lot and awesome and shakes his hands. He's like, I got to go, but I want you to do my old job. And then he got up and left. And I was like, what? That was not at all how this was supposed to happen. So I thought about it a lot. And I ended up making the decision to do this because actually, something you said, we are at a remarkable inflection point right now in terms of public health, healthcare, and the delivery of human services. And I assumed it would be fascinating when I got involved in it. It's proven to be more than fascinating. It's kind of all-consuming, right? And Actually, a friend of mine asked me the other day, when you pick up a newspaper these days, like everything you read in a newspaper has something to do with this world, right? And so he asked me, he's like, how does it feel to have your work be, something that people write about literally and talk about literally constantly? And to me, that's what's interesting about it, right? The world is so ripe for an interesting set of disruptions, and the things are changing, and I think people are interested in these changes. So that was why I made the decision I made. And I haven't regretted it for a second since. It's been phenomenal. So that's me. I'll tell you guys a little bit about what my group focuses on at HHS. So we're a real small office. I have between, I would say, 6 and, I don't know, maybe 15 people given the day. We tend to sort of absorb and sort of spit out people depending on what we're working on. And we work on a bunch of different stuff, but I think if you look at the things that we do, they kind of fall into the following major category, which is we look for what I would consider to be underutilized assets at the Department of Health and Human Services, and then figure out how we can drive more value through them. And in doing so, build a foundation for the next generation government. That last part is really important to me because we're at a point where there's a lot of attrition. We're losing a lot of long-term public sector employees. There's a lot of knowledge captured in those people, and we're not necessarily replacing it fast enough with the new generation of public servants. And to be honest, I can understand why. It's not, the bureaucracy that exists in government and the freedom that people have to actually execute on things the way that they are capable of is kind of non-existent. And there are lots of better opportunities for the younger generation, at least in their minds, right, coming out now. So that's a lot of what we're trying to change. Now, those of you guys who have followed what my group and Todd Park before me has done knows that we focused quite heavily in the beginning for the last few years on this idea of data liberation and taking this undervalued asset of data that exists within the Department of Health and Human Services and putting it out there for people to use. That program in general has been, I think, a phenomenal success. And the timeline is quite interesting. So it started about 3.5 years ago with 45 people in a room at the Institute of Medicine. And basically the way it worked is that a whole bunch of these people got together, or these 45 people got together, a pile of data got thrown on the table, and a challenge was issued which said, come back in 90 days and show us what you can do with this data. Build some applications, do something interesting. And Bill, I think you were there, weren't you? So I'm telling a story that Bill might actually refute, but this is how I've heard it. So 90 days later, those 45 people came back into the room, and lo and behold, had created 21 applications out of this data that had not existed previously. And I think what that signaled to every single person in the room and the leadership of HHS and actually the White House was that this thing was real and there was some potential here. And so that was technically the first Health Data Palooza. Have you guys heard of the Health Data Palooza? Many of you? Yeah? So we just had the 4th one last week in Washington, D.C. 2,000 people showed up to this thing for 2.5 days. It was one of the most remarkable things I've ever seen. The energy in the building was amazing. The conversations, the keynote speakers we had, the panels that we had were, kind of mind-blowing in their content and enthusiasm. We saw yet another 200 companies that had not existed previously pitch their wares at this thing, and all of them were based on some form of data that we've put out there and that we've collected and curated and created over the years. And I think, when you look at it from a sort of philosophical perspective, we all know that we need to change the way the healthcare system in this country works, right? And part of that is reforming payment, and then part of that is reforming the way that care is provided. And the common element between all of these things is actually that data, right? If we can figure out if we can take that data and analyze it in the right way, we have a much better ability to actually change the way that payment works in this country. If we can do the same thing for care delivery, we can, leverage those same ideas and actually make something happen. And so I think this common denominator of data, this explosion of interest, what we saw at the Health Data Palooza last week has been, it portends I think a phenomenal direction that this whole thing is moving, and we don't plan on slowing that down. There are a couple of things that we're going to do a little bit differently. So the past few years have focused primarily on data liberation, taking these data sets that exist within HHS and setting them free to the world. But there are two other elements that I think are important now to really expand this movement. The first one is dissemination. We have a portal called healthdata.gov where we catalog all the data sets that we can find, put out some metadata about them, things like that. But we're not doing a great job, I think, at getting that information out as well as we can. We need to do better marketing. We need to talk to different groups of people and get this information out there in different ways. We need to change the way we describe some of these data sets. My favorite example is the description of the National Plan and Provider Enumeration System, NPPES data set, which some of you guys in this room probably know. When you read the first sentence of the description on healthdata.gov, it's this sort of very jargony sentence with lots of acronyms. And even when you tell subject matter experts, when you read them that description, they really don't know what's in that data set. Really, that data set is basically, it's not quite accurate, but it's basically a list of all the doctors in the United States and their specialties and where they are, right? It's a pretty useful data set, but we kind of go out of our way to obfuscate that somehow. So we're working on doing things like making our materials a little bit easier to understand, a little bit more accessible. And then the second thing we're doing is what I'll call education. We need to teach people how to use this stuff in ways that they don't know how to use right now. And I think actually, we've spent the past 3 years talking to what I would consider to be subject matter experts, people who are in the healthcare system, people who know the problems, people who know, kind of how to solve some of these things. But when you think about it, that world is this big, right? The world of people who know what to do with data and know how to visualize data and know how to build things out of data, that world is this big. And if we can attack that world, then I think we have a much, much stronger opportunity to actually solve some of these problems. And in fact, one of the things I really like to talk about is every industry that I've ever seen that's been disrupted, and my favorite example of this is telephony and Skype, right, was disrupted by people who knew nothing about the industry, right? And the reason that is because they don't know what they don't know, right? They're not scared away by how crazy it is. And so with healthcare, right, healthcare is a crazy industry. It's complicated, there's regulations, the enterprise buyers are it's impossible to navigate those systems, but if you have a really good idea and you don't know that stuff, you're going to go and do it. And so we're seeing companies spring up now that have great ideas and are actually executing in really interesting ways, who have no experience whatsoever, and if they had experience, they might not have done it. So a great example, a company that I introduced on the main stage at Data Palooza last week is a company called Aiden. Really simple idea, but it was, they came up with the idea because they had a personal experience. The two co-founders separately had this experience where a family member went in for a procedure and needed to go into a post-acute care facility. And upon discharge, both of their experiences were exactly the same. They got a photocopied sheet of paper that literally listed 30 post-acute care facilities in the area and their phone numbers and their addresses, and that was it. No other detail whatsoever. And so they did what most people would do. They picked the one closest to home, called them up, put their loved one in there. And so Mike Galbo tells a story. His grandmother went into this one facility where this place had a history of over-medication. She was over-medicated. She was basically hallucinating for a week. It was a terrible situation. And so he and his co-founder basically had this idea to say, look, there's got to be information out there that we can use to give people a better experience and help them select post-acute care facilities based on their criteria and based on ratings and based on information. And it turns out, hey, we have a whole bunch of data sets that do exactly that, right? And so they did. They started this company that now allows anybody, you go to myaiden.com and you can basically plan and select the appropriate post-acute care facility for your family member. Hospital discharge planners are using it to help people select the right place. And so I think it's a phenomenal example. They knew nothing about the healthcare space before they got involved in it, and yet they dove into a relatively complex area and used data to help them kind of do that. So that's the data side. The second what I would consider to be underutilized or undervalued asset that we have at the department is something that actually is pretty meaningful to me personally. I really like people. I think people are very interesting, and I think that there's a lot of talent out there that we don't take enough advantage of. When I look at the Department of Health and Human Services, we have 90,000 people that work for this department who, for the most part, are pretty smart, who are working on really interesting problems, who are there for the right reasons, and who have really good ideas but are unable to execute on those ideas because of the way that the system is structured, because of the hierarchy, because of the sort of siloed nature of government, and because of the fact that we operate in this incredibly risk-adverse environment where the lawyers seem to have taken control of everything. And I know just from my time in Maryland that academia is not too dissimilar from that, and so I think we're actually kind of fighting similar battles. So the way that I look at this is that if we can use my little group as a fulcrum almost to leverage the resources that exist out there. Remember, we're not subject matter experts in necessarily any of these areas, but we can find the right people and enable them to do better things. We actually stand a chance at really transforming the system. So what we're doing is we're creating a framework of 7 different programs that's designed to essentially enable this massive culture change within the Department of Health and Human Services, with the idea being that if we can change the culture, we can deliver much more effectively on the things that we're trying to do. And so the way it works is as follows. There are really a few layers to this. The first layer is what I'll call a foundational layer, based mainly on the idea of collaboration. So do you guys know who Tony Hsieh is? He's the founder and CEO of Zappos.com. So Tony Hsieh likes to talk about this idea of serendipitous collisions being the thing that drives disruptive innovation or new ideas. And I actually fully believe that. When you look at the history of innovation and you look at the history of both continuous and disruptive innovation, what you find is that the most important and interesting breakthroughs come when you get different groups of people with different experiences and different cultural backgrounds coming together in a single space and having ideas and people bouncing off each other in interesting ways. So what we're doing at HHS is trying to enable this idea of serendipitous collisions by building both first a virtual layer for collaboration. And this is a simple professional networking or collaboration platform. We based it on Yammer because it was easy. But the idea is not just to allow people to communicate, but really to sort of subvert the hierarchical nature of the way that things work. And my favorite example of this, there's a guy named Ned Holland, who's essentially the COO for the Department of Health and Human Services. He's basically the number 4 guy in the department. Great guy. When we first launched the platform, he actually posted a message that said, "I'm giving a talk in Kansas City in a couple of weeks on innovation in the department. Does anybody out there have any ideas or any suggestions about what we can do?" This was remarkable, first of all, because Ned asked the question not just of his direct reports, but of the entire department. But what's even more remarkable is that people actually responded to him from all over the place and from all levels, which, I mean, think about it. If you're a GS9, you don't talk to Ned Holland, right? You talk to your boss, who talks to their boss, who talks to their boss, who talks to their boss, et cetera, and eventually you get to Ned Holland. And so the fact that we're enabling this kind of communication across boundaries and across these hierarchical levels, I think gives us a huge opportunity to take advantage of the fact that we have people in these lower levels who are enthusiastic and smart and have great ideas, but they just never see the light of day. So that's the virtual side. On the physical side, I don't know if many of you guys have walked through the halls of the Hubert H. Humphrey building in Washington, D.C., but I hate that building. It basically, long, dark corridors, very few people wandering around. When you wander off one of the corridors, you see basically cubicles that go to the sky and shut doors, and the only thing that you'll serendipitously collide with in there is air, right? I mean, it's bad. And so what we're trying to do is actually build a physical space for this kind of collaboration. We're calling it HHS Labs, and it's real simple. Think about it like a Silicon Valley style open floor plan co-working space, cheap modular furniture, right? Like go to IKEA and buy the cheapest stuff you can find, but just make it movable. Writable surfaces, paint everything with that whiteboard printing and write all over the place. Some technology. Wi-Fi. We don't have Wi-Fi in the Hubert H. Humphrey building, right? I mean, come on, this is 2013. Anyway, things like that, but make it a space where people can come in and actually work together and try to solve some of these interesting problems. And one of the things that I really want to do with this space is, and I don't know if I'm going to be able to pull this off, but I want to make it open to the outside world as well, with the idea being that we have good ideas inside, but we also have a lot of good ideas outside. And we talk to a lot of people in the external world all the time who come to DC a lot for meetings and for shows and for conferences and what have you. Wouldn't it be great if they had a couple of hours of downtime and they wanted, they needed to kill a couple hours or go work from somewhere, they could come work from our space and interact and, kind of get involved. And so I'm trying to figure out how we can do that from the security and the logistics perspective. But I think that that's, I think that that's an important thing, and that's the second sort of aspect of this collaboration idea. Now, once we have that foundation for collaboration, the next layer up is what I like to think of as an identification layer. There are, of the 90,000 people that work for the Department of Health and Human Services, there are any number of people who are ready to have their potential activated, right? They're just sort of waiting for this opportunity. And our job is really to find those people and figure out who they are and then help them realize this potential. And so we have two different programs that we're building right now that are designed to do this. One, which we haven't kicked off yet, and we probably won't for another few months, is what we're calling Fair Trade. And the idea is basically, you guys know what Kickstarter is? And okay, so crowdfunding platform. Think Kickstarter for internal resources, right? So the idea is, I want to build a web application, but I don't know how to design a website or build a web page or rack a server, but I know I want to find people who do. And so I make a little video, I post my story, I post my idea, and I try to get people from across the department to commit some of their time to actually help me realize this vision. We, interestingly, have some examples of this already happening without a platform like this in existence, which is why we think it's a pretty good idea. The example I like to use is this woman, Gwen Shinko, from the National Institute of Allergies and Infectious Diseases, was out for a jog one day and had this idea. Turns out that at NIH, you get all this lab equipment that gets replaced quite frequently. So, maybe you have a centrifuge that, spins at a certain speed, but there's this new centrifuge that comes out that spins that much faster, and it's like, you got to have it, so they get it. And then the old centrifuge, it turns out, just disappears into this great NIH graveyard in the sky, and nobody sees or hears from it again. And she thought, that's not great, because that centrifuge is actually useful, and there's probably a lab down the hall that doesn't have one that could use this centrifuge. And so she came up with this idea to build a site called NIH Free Stuff, right? Which is basically like Craigslist for NIH stuff. And she actually went out and found somebody who knew how to build a website and somebody who knew how to design a website and launched the site just within her institute. And then grew it for a year or so. It got some recognition. We gave it an award. And now it's actually being rolled out across the entire NIH, which is 25,000 people, and obviously a massive operation. So, things like that. We're trying to find and enable people who have ideas like that to do those things. So that's the first one. The second one is actually something that we launched about a month and a half ago called HHS Ignite. Think of it as seed funding for startup ideas. So in government, it's really hard to kick off a new line item of funding in the budget. It's very easy to get things to go on forever, but it's real hard to kick off new things. And so what we wanted to do was enable people to try things in a way that they haven't been able to try things before. Now, this is not large. We basically scraped together $80,000, and we decided we'd give out 8 awards of $10,000 each to people who applied for this stuff. And the interesting thing, though, is it's less about the money and more about the other aspect, which is that if you are accepted into this program, we guarantee you that you will get either 100% of your time for 3 months or 50% of your time for 6 months to actually work on it, which is a big deal, right? And so in order to apply, you need to get the permission of your supervisor because they need to be on board with this. But what's really interesting is that we just closed the application process, I think 3 weeks ago now. And we expected to get 15 or 20 applications. This is the first time we've done it. We marketed it a little bit, but not that heavily. We got 67 applications, which is amazing. Now, the quality, it's actually interesting. We did a relatively rigorous scoring process on these, and if you chart the average scores for each project, it is actually a bell curve. There are a few that are pretty terrible. There are a few that are mostly okay, and then there are a bunch that are, spectacular, which is great because we only have 8 to do. So it actually worked out pretty well. And we're just in the process right now of, the reason this is going to work is because the secretary actually makes the picks, right? She's the one who looks at the sort of winnowed down list and makes her selections. And because she's conferring the status on those individuals and those projects, they're her projects, right? So they get done. So that's the idea with Ignite. We're trying to find people who can do these things. So that's the internal identification layer. Then the next layer up is the idea that there are lots and lots of people out there who have great ideas that are not us, right? And we want to take advantage of that as much as we can. So the first piece of that is our prizes and competitions program based on the America Competes Act. Over the last couple of years, we've done over 100 prizes and challenges competitions, given away millions and millions of dollars, gotten some really, really great ideas and great projects through the door. And we're going to continue to do that because we think that that's a good way to get external expertise inside. And then the second piece is a program we call HHS Entrepreneurs. We actually have one of our HHS entrepreneurs sitting right there. Zach Jiwa is here. So this is I was a little skeptical of this program at first, but it's proven to be one of the most remarkable things I've ever seen. The idea is simple. High risk, high reward projects that would not happen without external influence coming in and helping to execute them. The sub-goal of these projects is to actually begin to change the culture in these groups. And the way that works is that if you have a pretty tough problem to solve, and I should also say, they're only here for a year, right? So if you have a pretty tough problem to solve and you only have a year to solve it, almost by definition, you gotta bend a few rules, right? Or try to do things a little bit differently. And so the goal is to prove to the career staff that don't really feel as free to do that it's okay, right? That you can actually try to do new things and you can do them in different ways and you're not going to get your head cut off. You're not going to, get a bad performance report. In fact, you might get a good performance report. So the 4 projects are really interesting. Zach's project is all about, so you guys know in the Affordable Care Act, one of the things it did was basically standardize Medicaid eligibility based on adjusted gross income. We in the federal government are creating a MAGI rules engine because we have to for the federal marketplace. But all the states have to do a MAGI rules engine too. So it makes a lot of sense if we can basically create one MAGI rules engine and then provide that as a service to other people, right? It's a good idea. So that's the project Zach is working on. And listen, he's running into all kinds of crazy resistance inside of CMS. He'll bend your ear for a while if you want to talk to him after this. But it's been interesting to kind of see how that progresses and watch what we're doing. And look, if we can't get CMS to own it, we might actually end up doing it in a way that is a little bit, subversive, but still solves the problem. And so we'll see how this ends up. One other really great example. Office of the National Coordinator for Health IT and CMS work on this idea of creating these e-clinical quality metrics, right? So all the data that's captured from electronic medical record systems and claim systems and things like that get fed into a set of algorithms to determine electronically some quality score. One of the guys who is working on this, Kevin Larson, he's the CMO for ONC, he had experience from a previous healthcare system that he worked in using lean methodologies, so Six Sigma, lean, all that kind of stuff, to actually help them improve their processes. And he thought, this would be a really interesting set of processes to apply lean techniques to. And so they brought in this woman, Mindy Hangsleben from Intel. She quit her job at Intel, moved across the country to do this for a year, to basically come in and leanify these processes. So a couple of interesting statistics. Currently takes between 3 to 5 years to develop a single quality metric. because of all the stuff that it has to go through. Mindy comes in, and as the first step of sort of leaning the process out, she does a error rate analysis on each step of the process. It turns out, when she was done, that we literally had a 100% error rate. Okay? There was an error, at least one error in every step of the process. Now, I thought that was great, because that just meant that there was only one way we could go, right? We can only get better. But what's remarkable is that after working with these guys for now 7 months or so, they've actually put the first new process through the system, and it's gone from 3 to 5 years to 3 months, which is like amazing, right? But what's even more amazing is that this idea of lean has, it's just permeated the culture of these groups at CMS and ONC to the point where they're training 4 new people on all of this lean stuff. They brought in another entrepreneur to kind of continue this once Mindy leaves. And somebody from ONC actually came up to me the other day and told me that she's now using lean techniques to manage her grocery shopping. So, to me, this is the archetype of what we're trying to do, right? Like, a good idea comes in that is very different from the way things actually work. Because look, the whole thing about lean is that it basically empowers anybody to pull the ripcord and say, stop, we're doing something wrong, which is not how government works at all, right? So the fact that this has actually worked and it's like impregnated itself into the culture is phenomenal to me. So, so that's the Entrepreneurs Program. And we're actually, I should also say, this week we'll be presenting to the Secretary our suggestions for the next round of HHS Entrepreneurs, which we're hoping to kick off in the fall of this year, which means that in the next month or so, we'll be putting out a call for a new cohort of year-long fellows to quit their jobs and move to DC and do interesting things. So keep your eyes out for that, because if you guys know anybody interesting who would be interested in something like this, we're definitely looking to talk to them. So that's the external piece. And then the final piece is what we call HHS Innovates. To me, this is sort of the viral growth engine of the whole thing. We can build this collaboration thing, we can identify all the people we want, we can bring in external people, but until we have a way of recognizing people for doing interesting and effective things and saying, hey, keep doing this, and then what I think is hopefully virally infecting the peers that sit around them, I don't think we'll be able to, it won't spin itself up, right? We'll have to continually keep pushing. And the whole idea is that, my time here by definition is limited. So if we can figure out a way to kind of keep this engine going until it's self-perpetuating, then we have a shot at actually making a change. And so it's pretty simple. Basically, either your peers or yourself nominates your work. It doesn't have to be successful. It just has to be interesting and challenging of the status quo in some way. Everybody across the department votes on these different projects. The ones that receive the most votes move on to the next round. The secretary then picks her 3 favorites and her 3 honorable mentions, and we bring everybody to DC for a day-long event where they meet the secretary and the deputy secretary, have their pictures taken, they get to talk to them about a whole bunch of stuff. There's a lunch. They actually get a check for $2,500 per person, but that's like the least important piece of it. Their families come to this thing, like it's a big deal. But what happens is, these people then go back to where they're from, and they say, wait, this stuff is valued. And their peers look at them and say, wow, just by trying something new, they got to go to DC and they got this check and they met the secretary. And so the idea is if we can use that as sort of this engine of growth, then we have a shot at keeping this going. So I talked for way longer than I thought I was going to. I'm sorry about that. I just get excited about this stuff. But that's basically what we're working on. So, finding these assets that are underutilized and driving value through them and figuring out how to use all of this stuff to build the foundation for the next generation government. So I'm happy to answer any questions. Really sorry I talked so long. Yes. By the way, I just have to say, Daniel predicted that you would have the first question.
I'm very happy to hear about the Agile application. One of the things, and many of us have been questioning, why do we need a 56 MMIS system?
Yeah.
Why does every state have to reproduce the wheel? Especially with web services, it would be really great if HHS could, the things that are at the federal level, make available services.
Yep.
It will reduce everyone's costs.
Right.
Secondly, when you change policy, everyone's will get it almost automatically inherited, right? It would save us a lot of money and
Right.
time,
Right.
make us more effective. So just want to give you kudos. Please do more.
So there's so much to say to that statement. So when I was in Maryland, I asked somebody in the state, I won't say who, but I asked somebody in the state why we were building our own marketplace when the feds were building one that we could probably just use. And the response was, we don't think they can get it done, right? So that was the first statement, which we'll see. I think it'll get done. It's not going to be, sort of every bell and whistle, but it'll be a V1 that works and lets people do eligibility and get enrolled in healthcare coverage. But your point is exactly right. I mean, everything we're building should be made available as a service, and maybe it won't be on day one, but it hopefully will be at some point in the future. There are actually some very enterprising entities out there, like the state of Massachusetts, who are building their marketplace as a shared service from day one because they need to sustain it somehow, right? And their whole idea of sustainability is, hell, we'll build it and we'll let other people use it and we'll charge them a fee. It's actually really smart, right? Because it's still going to cost the state a hell of a lot less to use their shared service than it would be to build their own marketplace. So the MMIS, I mean, you mentioned MMIS, that's a whole other can of worms, but something that I've actually been interested in since I was in the state level. And what I can tell you is that we are actually working on this in a number of different ways. The way that CMS regs work right now, states are not financially incented to implement these systems in the right way. They're incented to do it completely differently. So we're trying to change those incentives in a bunch of different ways. And you might actually hear a little bit about that on your federal panel here on Wednesday, maybe. So I'm going to foreshadow a little bit, but it should be really interesting.
Okay, so we're just passing the microphone down the line here. You started off, Bryan, with strategic goals for transforming health and human services. And I wondered if you had some thoughts about what those strategic goals might be as it relates to the states. And then, if yes, what are the disruptions that you think would be most useful in those transformations?
I think there are kind of a couple of things. One is actually goes very much to the previous question, right? Really fixing the financial incentives for technology implementations in a lot of these different categories of human service provision. So MMIS is one, SACWIS is another. I mean, there's a whole bunch, right? So that's sort of one thing, realigning financial incentives, making things work better from a regulatory perspective. I think that the data stuff is actually really interesting as well. So we worked actually quite closely with New York State to help them liberate their data. And actually, I don't know if any of you guys were at the Datapalooza, you saw Dr. Nirav Shah get his sort of Health Data Liberator of the Year award on the main stage, but he did a great job at putting that information out there and then trying to make it usable and useful. We're working with California. California is really interesting. We're working with a bunch of organizations in California right now to do the same thing. The legislators there don't quite get it yet, so there's a lot of work we have to do. But I think that if we can. A lot of the we have a ton of data, right? But a lot of the really interesting data is on the state and local level because that's where the rubber meets the road. And so the more that we can work with those entities to help them recognize the value of this stuff and get that data out there, the better off we'll be. And so that's really a big area of focus as well.
Bryan?
Oh, yeah, sorry. To you next.
Okay, it's on now. Bryan, could you comment on how you would advise us to leverage the great enthusiasm and excitement in the health space into the human service space? How do we transition? How do we get the same leverage where we're talking about TANF data and we're talking about CPS data and all the other great problems we need to address in the human services?
That's a really good question. So, a lot of the stuff that happens, I think, in healthcare happens because there's a massive financial incentive, right? $2.8 trillion a year, a lot of waste in the system, a lot of ways to make things better. I think a lot of entrepreneurs and current actors in the ecosystem see ways to actually make a lot of money in this country that drives a lot of new development, right? There was a I read an article actually a couple of days ago that I thought was really interesting about how we can apply a lot of those same thoughts to spaces that are not necessarily commonly considered to be, sort of to have economic incentives, right? If you think about the number of people in this country who are TANF or SNAP eligible, who are on Medicaid, who have kids in the CHIP program, things like that. That's a massive number of people, right? Which means that, even if they're not, even if they don't have a lot of money, there is actually a significant economic incentive to kind of helping them do the right thing, both from the sort of state budget level and from the individual level. And by doing so, you actually do something really good, right? Like you kind of help people do good work and do good things. And so I think that there's a way that we can figure out how to further incentivize those behaviors. To be honest, we have not spent a lot of time on it. But I think it's something that we really should be doing. And I think actually, this is one of the areas where states can help quite a bit, right? States and localities, because if you think about where the bulk of that money is spent, it's spent out of state budgets, right? We grant the money, but states are the ones who allocate it. So it's worth thinking about. I don't have a great answer for you, but I think it's a huge opportunity. Yeah.
If you're looking at bringing the data and also creating standards for the interoperability, how are you looking at the privacy and confidentiality?
So privacy is always of paramount importance to us. It's something that we consider quite heavily, and in fact is a lot of the reason why it's so difficult to get data out of CMS, right? Because nobody wants to be responsible for letting a whole bunch of Mrs. Smith's claims data out there. Having said that, we exist in a really weird time right now. I was just on a panel a couple of weeks ago with this woman who's actually a professor at the University of Maryland in the computer science department. She was talking about how when you ask people out there if they're worried about posting the data that they post on Facebook and Twitter about getting out there and people knowing about it, they say, no, it's fine. I put it on Facebook. I expected people to see it. But then what they don't realize is that because we have such massive data sets now and the tools with which to analyze them, it turns out that you can actually impute all kinds of things about people that they never, ever, ever wanted you to know. So, the example she gave me was like, if you take a bunch of different elements of data on Facebook and then add, people clicking the like button on the curly fry page, it's actually very strongly correlated with sexual preference, right? Think about that. That's not necessarily something that people would want to put out there, but the idea is that you can take all of this data and mash it all together and analyze it in interesting ways, and all of a sudden you know lots of stuff about a lot of people. So I think that's also why we have to be even more careful about this stuff in a certain sense, right? The mosaic effect is real, and it exists, and as more data becomes public, it just becomes that much harder to manage. So the short answer to your question, we take it very seriously, and we try to weigh privacy very heavily when it comes to actually releasing data, but we're trying to prefer releasing data if we can.
And have you considered how you might standardize some of the privacy agreements currently regulated so that where it is allowable, it's less of a barrier?
Yeah, so you mean clarifying things like HIPAA and the Privacy Act? Yeah, we're always kind of working on that. Just as an example, I got an email from a guy who runs it's essentially an SMS service that is working with some providers to transmit health-related messages to their patients. And he's recently gotten some pushback because the regs that the clarification that we just released seemed to make that not possible where it was possible before, which was not the intention. And so he emailed me, and I emailed the guys who actually put out these regs, and they talked to him, and now they're fixing it. But I think it's a constant sort of process, right? Yeah.
I just spent 2 years at the Innovation Center at CMS developing some of those new payment models, and one of the issues on the data availability is timeliness. And can you talk about sort of the basic capability of legacy systems to deliver the timely data that's required for people to manage care effectively, and your thoughts on sort of how we get where we need to be?
Can I ask you a question?
Yeah.
This is a serious question. How timely does the data need to be, in your opinion?
Weekly?
Okay. So here's the reason I asked that question. I've heard some providers tell me they need daily data, right? They need a new dump of data every night.
Yeah.
And then I talk to people at CMMI, and they're like, they don't need that. They just need monthly, and we're already giving them monthly. It's fine. I don't know what the right answer to that is. So you think weekly is what it needs to be?
Daily works better.
So I kind of think so, too. I mean,
No, I mean, if somebody's going into the hospital,
I would imagine that daily.
you like to know that they're going in.
Yeah, I mean, ideally, real time would be even better, right? From what I understand of the architecture of the CMS systems, it's relatively, I'm trying to think of a nice word for it. Arcane. I mean, you're talking about 30-year-old COBOL-based systems that I mean, if you look at the architecture diagram, it's spaghetti, right? And it's logical how that happened. Basically, Congress passes a law, there's a new program that needs to get spooled up, they spin up a new instance and say, hey, we need to create this new data warehouse off of the claims database because we need to do X, Y, and Z. So they do, but that forms this whole other architecture out here. I mean, it's really interesting, to put it nicely. So I think that one of the key things to do is to figure out how to untangle that mess of spaghetti and kind of build something that works the right way. I think part of the challenge is that CMS, from a sort of engineering perspective, has their hands full right now with the marketplace, and it's kind of the main focus until at least October, probably until the end of this year, beginning of next year. But I think after that, we're going to start to see a lot of push. One of the things that I think we should try to encourage is if providers out there who are part of this ACO model or bundled payments or whatever really think that they need data more frequently than they're getting it, to push for it, right? Yeah, I mean, but like loudly and vigorously, and I mean, make it a priority where I mean, I know that people are thinking about it, but I don't know that anybody's convinced that it needs to happen, right? So I mean, I think that there's an external element that we could really use to help us do that.
You mentioned something I heard our CIO say last week, that you're trying to turn your office into feeling more like a tech startup. Coming from a tech startup, you know you don't have the options of issuing stock options to your employees. At least I don't think you can yet. And I've never really interviewed a lot of computer science grads who said I was just dreaming of writing TANF software, when I went to school. How do you retain and motivate your staff in a very, very competitive environment like it is today?
So I don't think it's about stock options. I don't think it's about salary. I think if you go into the halls of government and you talk to people who are doing these jobs, most of them could be out in the world making a lot more money doing other things. It's about the mission, right? It's about doing the right thing for your fellow citizens and for people who, might be needier than you are, or to use your skills to actually, do something that's sort of globally beneficial. I would actually guess that most of the people in this room kind of fall into that category. And so I think right now, you're selling the mission despite the challenges of government, right? So if I'm trying to convince somebody who's a superstar to come into government, the statement is, listen, you can deliver on the mission, you're gonna have to deal with a bunch of bullshit, but let's just, trust me, it'll be fine. So what we're trying to do is to both compel people by the mission, but also bring them into an environment which does operate much more like a tech startup, right? Give them, I didn't mention this when I was speaking, but I have this, I kind of hate the word innovation these days, because to me the word doesn't really mean a whole lot. And furthermore, it doesn't encode any action. If I tell you guys to go innovate, what are you going to do, right? And so what we've redefined it, and the way we've redefined it is that we say that innovation is the direct result of the freedom to experiment. Right? Because if I can teach you how to experiment, I can teach you to develop a hypothesis and test that hypothesis and generate metrics and then learn from those tests and iterate that into future revisions. And that also encodes the ability to fail, right? Unsuccessful experiments are okay as long as you learn from them. And then I can also give you freedom to do those things, right? I can carve out some breathing room. And so to answer your question, if we can build an environment which does provide people the freedom to experiment, right, then not only do I have the mission, but I also have the space, right? And that's what I think we can use to compel people.